the topic entitled Stroke's Silent Partner. Now, what is the name of this silent partner in the background that can promote stroke? In fact, based on research, it can increase the risk of stroke by up to 5 times. And in the UK alone here, 5 cases of stroke is promoted by this condition, this silent partner. What's the name of this partner? The name of this biggest promoter is a heart condition called atrial fibrillation, or AFib for short, or AF for short. AFib, what is it? You see, the normal heart, we have 4 chambers. The top chambers will release blood to the lower chambers. Of course, the lower chamber, the left side, is called a ventricle, which is the main pump to pump blood throughout the whole body, and the right side of the lower chamber will pump blood to your lungs to collect oxygen. But you see, there's a need for blood to get into the lower chambers for this distribution of blood. What regulates this smooth release of blood into the lower chambers from the upper chambers is your natural pacemaker located in the right side of your heart. It's called the sinus nodes. But you see, if the heart should work beautifully, we should have these electrical impulses coming from that area. But in atrial fibrillation, we have additional signals, electrical impulses from the other upper chamber. And so it causes disorganization. So instead of the upper chamber to contract beautifully to release blood into the lower chamber, it will fibrillate or quiver or shake. So and when it shakes, we don't have enough blood getting down. So blood can stay in the upper chamber, and if it stays a little while, it's called a blood pool. It means staying there, and then it leads to clot formation. And when the clot forms, it travels towards the brain. That is the first stop. And then it blocks the tiny arteries in your brain, and then it causes ischemic stroke, which is 87% of stroke cases. And as we know, stroke is something preventable. It's preventable, but it's not a good thing because it disables people and it can lead even to death. Not only the mobility problem and speaking issue, but then what are the symptoms? Many people don't experience symptoms of atrial fibrillation. Many people don't even know about it. And some people may have some symptoms. The early symptoms are the following. You're experiencing fast or fluttering heartbeat. It means that your heart will beat, sometimes it will skip, the beat will skip or beat too fast in your chest. And you will feel tired even after sleeping 8 hours at night. And you'll be short of breath when you're doing anything demanding, physically demanding. You may feel dizzy or may feel like fainting. It may reduce your ability to exercise, and you may have chest discomfort. When atrial fibrillation advances, you may have persistent palpitation and severe fatigue, and then you'll be short of breath even at rest when you're sitting down, even talking to somebody. You may have swelling in your legs or abdomen, and you may experience cognitive issues like forgetfulness, confusion, trouble focusing, or slow thinking and difficulty speaking. But what causes this atrial fibrillation? In fact, if you look at it, high blood pressure will cause it. High blood pressure will stretch your heart muscles and cause disturbance of the electrical impulses. Coronary artery disease, it means blocked heart arteries, can also cause that. Heart failure or enlarged heart can cause atrial fibrillation. Overactive thyroid, that is hyperthyroidism, can also cause atrial fibrillation. Sleep apnea, when your breathing will cease and restart. It can go on 5 to 10 times, 5 to 100 times I should say, at night. That it leads to repeat oxygen drops, which causes strain on your heart and can change the rhythm of your heartbeat at night. Heavy alcohol use, of course, course can contribute to that. Imbalance of potassium, magnesium, and calcium in your blood can lead to atrial fibrillation. Diabetes can lead to that as well. As we age, when our heart tissue becomes stiffer, it's prone to electrical misfiring and can lead to atrial fibrillation. If you're obese, high weight, okay, and then if you have done surgery before, or if you take certain medication like steroid or asthma medication, it can lead to atrial fibrillation. Beloveds, if you have any heart condition or any chronic problem, a call away. Share this number, be a blessing to someone as well. Calling outside the UK is +44 738 464 7300. And go to my YouTube channel also so that you'll be alerted for future programs. If you're happy with what I'm doing, put in Dr. James Naturalink, Dr. James Naturalink, and go and subscribe and support the channel. Thank you very much for listening.